we're super grateful that Dr. Davis was super flexible and was able to join us this afternoon or this evening. So we have him today for an hour. We have him tomorrow for an hour for another training. If you'd like to attend that one, you can email me after this and I'll send you the link. So quick intro for Dr. Davis. Dr. Davis is a licensed clinical psychologist specializing in clinical health psychology and behavioral sleep medicine, including cognitive behavioral therapy for insomnia. He has specialized training in mood and sleep disorders, chronic pain, weight management, and in primary care mental health integration. So we're super excited for this specific webinar. Empower Idaho does tons of different kinds of trainings related to advocacy and education for behavioral health for adults in the state. So Dr. Davis has done several presentations for us in the past, so we're just super grateful he's here again. If you guys have any questions throughout, you can ask in the chat box, and I will be monitoring those and pass them along to Dr. Davis. Without further ado, I'll hand it over to him. So thank you again for all being here.
Yeah, thanks so much, Anna. One of the things that I want you all to know right off the bat is I actually really like to utilize the chat box for these kinds of presentations because my style or presentation style is I like to make things more interactive. I like to ask lots of questions. And for this presentation in particular, I was really hoping to make it more interactive because this kind of thing or this presentation, there are no like super clear answers. You know, I'm not just teaching you some protocol and I don't want to just be spouting off research for you all. So hopefully you all are comfortable with using the chat box and we can have some interesting conversation around our topic today, or men's mental health. So I also want to say, you know, that as a clinical psychologist, I have a pretty general background, you know, in more general kind of counseling and therapy. And over time, I have gotten more specialized in treating insomnia and chronic health conditions and helping people make lifestyle changes. So that's a little bit of my trajectory. And whenever Anna asked if I would do this presentation, you know, I was thinking like, oh, men's mental health. Well, I'm a man. I work with lots of men in my practice. And you know what? I've never even had any formal training on different differences that come up in gender and working with men. You've kind of figure it out. So anyways, what I'm trying to say is this was a fun presentation for me to put together and learn more and think a little more critically about why men may have different prevalences of different mental health conditions and how our culture influences the development and or expression of those disorders. So, all right, so our topics for today are actually our objectives is we want to talk more about how culture may influence presentation of mental health conditions in men. We're going to talk about differences in prevalence of mental health conditions associated with gender. We're going to talk a little bit about postpartum depression in men, so something that doesn't get talked about much at all, though is very real. And then we'll talk about how we can help support men's mental health and how to know when to seek treatment. So actually, this would be a good time to ask participants, which looks like we've got Katrina, Francine, and Doug here. Let's use the chat box here, and please let me know if there's anything that you were hoping to get out of the presentation today, and I would be happy to try to accommodate that. Crickets. Hopefully you're typing. Right. Well, thank you. Okay, how to be supportive for a male partner who's just started therapy. That is a great thing to discuss. Anything else? Even if you don't want to comment on this, can you say hi? Are you bots? Okay, thanks, Katrina. Hopefully we're all here to learn. Okay, you got an adult son, single father, 3 young children. How can you help support him? Probably. All right, great. Well, we will keep moving on. Okay, Doug, you signed your husband up for the webinar? Is he here? Shelly did. So who's here, Doug or Shelly? Oh, okay, you're both here. Great. So, I think one of the things that we're gonna learn more is that doing a presentation on men's mental health, I didn't expect it to be incredibly well attended. And it's kind of a catch-22 in that oftentimes the people that could potentially benefit from a presentation like this the most would actually probably not attend because of some of the cultural factors that we'll be discussing today. So it's kind of a tough spot to reach an audience when you're working against the culture, and the culture, and in fact has helped develop some of the problems that men would run into anyways.
Real quick, Dr. Davis. We actually,
yes.
this is Anna. We actually had a much larger, we had about 15 people registered for last week. So just so you know, people are excited, and tomorrow we'll have a lot of folks too also. Hopefully you guys can all join us.
Okay, thanks. That's reassuring. So yeah, talk tomorrow, very similar to today, but we take it from a more of a therapist perspective. All right, so let's talk a little bit about how culture influences mental health conditions in men. So boys are often taught that in order to be accepted within their culture or society, they need to express masculine traits. And so the question for you all is, what do you consider masculine? What are the traits that you would identify as being masculine in a man? Okay, maybe more reserved. And yeah, reserved in the sense that they probably don't talk about their feelings, they don't talk about their problems as much. Definitely a sense of trying to do everything on your own. Kind of probably maybe even exacerbated here in a state like Idaho, where we really value kind of this idea of like rugged individualism, libertarians. Okay, must be brave, so reserved, brave. Anything else? Shelly and Doug, what do you think would make a man masculine? All right, well, while you are thinking a little bit about that, some of the things that are commonly associated with masculinity, unfortunately, one of the main things would be anti-femininity. Another thing would be achievement. We really value our achievement in our culture, particularly for men. And then this idea of a shul of the appearance of weakness, probably very similar to what Katrina is saying with being brave. Oftentimes masculinity gets associated with adventure, taking risks, and then even violence. You think about male-dominated sports. What are some of the most popular sports out there? We think about football, MMA, fighting, boxing. These are very violent sports, and that's what we idolize in our culture. Now, I think a really important note about masculine traits is that they are not inherently bad. They can actually be really good, and they help make men who they are. But they can also really work against us in many ways that we'll be discussing. Particularly, I mean, can you all think of any examples of like this idea of anti-femininity that expressing any feminine traits is not masculine. That can make it really hard for boys or men to fit in to society. Any examples of that? What did your, oh, there aren't too many men out there, but what did your coaches say? Or these, well, I'll just tell you what my coaches told me. You know, people would say things like, don't be a girl, you know, don't do that. And like even very literally, you know, say things at any sign of, yeah, don't be a sissy, don't be a girl, don't act like a girl, be a man. You know, this image I have over here from the Violence Stops Here campaign, you know, man up, you know, and that is very common within our culture. And well, like we're saying, this is one of the reasons that we have some of the problems that we do have. So if we're saying that men, if the idea of being masculine is you can't express any feminine traits, you have to achieve things, you cannot look weak, and you need to be out there adventuring and taking risk, and it's okay if you're resorting to violence. How do you think those qualities influence the mental health of men? How do you think that that would affect them? Y'all didn't know that you were coming for a graduate level seminar today on men's mental health. Any ideas? Yeah, it discourages them from talking about their feelings. Like that's a sign of weakness. If I talk about the feelings, well, then something must be wrong with me because I can't handle it myself. And then that is what ends up creating more of the problems. Yeah, I'm just checking in on what you're all saying. Yeah, so Katrina's saying makes them more reserved, discourages them from talking about their feelings. They're going to struggle more. It's definitely going to have a negative impact. And it's kind of like, so like, man up, you know, deal with it. Like, not that other people are necessarily telling men this, but this is the kind of the internalized dialogue that you may have if you grow up in that kind of culture. So I wanted to show a really short video from the American Psychological Association called Boys Don't Cry, that's kind of talking about some of the same things that we are. So hopefully this comes through fine and go to. Oh, geez. I gotta not click on anything else. My bad.
Dr. Davis, the sound is not coming through GoTo, but I can send the link out after this. That is one of the limitations of GoTo trading.
Thank you for letting me know before we went through the whole 3 minutes. I hadn't shown a video in GoTo training before, so I wasn't sure if that would work or not. I'm glad I picked a very short one that doesn't influence the presentation a whole lot. So anyways, I think you could probably see from the video what was going on, and you have all these boys, you know, that are just kind of echoing like the things that they've been heard, though that's probably the part you couldn't hear. But they're saying like man up, and like you all were saying, calling each other sissies, and you could see them fighting or practicing boxing. And the video is all about how our culture influences that kind of behavior, and how an antidote to that is being loving and supporting for boys, and allowing them to, or accepting them for who they are, when they are experiencing emotions that they may, that culture would tell them, not to express. And so that is, one of the ways that we can help fight this, but more to come on that. Okay, so we're going to get into some more figures here in a second. But we know that men express or demonstrate higher rates of impulse control disorders. So things like oppositional defiant disorder, conduct disorder, increased rates of substance use, and much higher rates of suicidality. So you all were kind of answering this question already, but why would those aspects of this cultural ideal of masculinity lead to those kinds of problems in particular? So particularly these, the idea of acting out, oftentimes violently, not listening to authority, using substances, and potentially taking their own lives. So yeah, I really like what Katrina had said after the last question. An equation of being loving equals weakness. It's a part of it. All right, so I think Anna has a really good response to it. So they need to have a way to cope. And if they don't feel safe sharing or talking about what's going on, it's going to come out some way or another, right? You can't just bottle things up forever and expect them to go away. Oftentimes I liken this to like holding a big beach ball and you're trying to hold it underwater. You can spend all your energy trying to hold it under, but if your grip loosens on that or you get distracted by something else, then it can easily come out to the surface. And I think that's, sometimes where you see like violent outbursts and stuff, because men may be really trying to repress their feelings, but then something happens and they can't keep up with it, and boom, it all comes up because you just can't keep it bottled up forever. All right, any other ideas there? So to back up a little bit farther, expressing feelings that are incompatible with masculine ideals is likely considered taboo or unacceptable. Like, I can't let myself do that because then I'm not who I think I am anymore, who society's telling me I should be. And if you're feeling something that is unacceptable by your culture, what happens? Well, you do what you all have said. You end up repressing it. And if you repress it or try to avoid it, well, then what happens? Well, then you are more likely to act out when expressing emotions. You may numb or avoid your feelings by abusing substances, and or if people feel like they have no other options because they're hurting so much, that's when they may experience increased rates of suicidality or thinking about suicide, and then ultimately completing suicide more often. Okay, so let's look at some mental health conditions and their prevalence split between men and women. So in terms of anxiety disorders, men still had 25% of men will experience an anxiety disorder, up to 36% of women will. Panic disorder, lower, but about I guess twice as more frequent in women. Phobias also twice as more frequent in women. PTSD, also more common in women. OCD, more common in women. Depression, more common in women. Though I think a lot of these, stats they're gonna be biased by how they're assessed, and we know that women are much more likely to bring up how they're feeling with providers, which in turn would lead to more diagnoses and potential treatment too. So I guess that's something that we're always dealing with when we're looking at these kinds of statistics, is that we're limited by how we're assessing things. But then we see these higher rates of impulse control disorders and substance abuse disorders, with men being twice as more likely to abuse substances as women. Is this surprising to anyone? Interesting. Thanks, Katrina. All right, let's look at rates of suicide. So in the United States, men are about 4 times as likely to commit suicide as women. So what this graph is saying, so it's graph over time in between 1990 and 2017, looking at the rates of suicide per 100,000 individuals. So 20 out of 100,000 men are completing suicide. And we can see in comparison to women that is quite a bit more. And well, both men and women have increased more frequently. And I know this, there are probably other trainings on suicidality. The one thing that I want to point out is that women tend to be more likely to commit or attempt suicide, but men are much more likely to complete suicide. And what I mean by that is they're oftentimes choosing more lethal means to harm themselves, and yeah, more likely to complete, even though they are not as likely to attempt. So this is a really big problem in our culture. And then this also holds up when you look at rates of suicide across the world. Understand this graph is you have your male suicide rate on the left-hand side and the female suicide rate on the right-hand side. So anything in this upper half of the graph is going to say that rates are higher than in men than in women. And so if you look at a country like Lithuania, you're having approximately 50 male suicides for every like 8 female suicides. Greenland is easy to view here. They're having about 75 male suicides for every 25 female suicides, so about 3 times more likely there. So this is, you know, across cultures, across different demographics, but we still see the same kind of thing. And part of that is, you know, oftentimes masculine ideals are very similar across other cultures. Maybe pronounced more in some cultures, maybe pronounced less in some cultures than we see in the United States. Once again, I'll ask you, anyone surprised about this? Or is this kind of consistent with how you imagined things were, if you've thought about this? All right, so I'm not seeing any comments come in about that. Let's talk about paternal postpartum depression. So I'm just going to make you type something into the chat box. Can men experience postpartum depression? What do you think? This is maybe the easiest question today. Certainly, yes. Anna and Katrina are all over it. And Katrina's even getting at some of the reasons why that may be. So, short answer here, yes, men definitely can. And we estimate that up to 10% of new fathers do meet diagnostic criteria for a major depressive episode within 1 year of childbirth. Well, why? Aren't babies supposed to be all fun and games, and you're just supposed to feel happy all the time if you have a baby? Um, shouldn't you just be thankful, grateful that you have a baby at home? What do you all think? Is that reality? Okay, so understanding financial pressure, major life changes. There's a lot of pressure in being a role model all the time, though. Fortunately, for brand new dads, there's not too much pressure to be a role model. Well, at least maybe there is. Maybe there's, you want to be living your life, being your best self. But at least those babies aren't gonna remember. Yeah, Katrina's saying there's so many added pressures. And if mom's having mental health issues, it can be very difficult for everyone. Yes, totally agree with all this. I've got a 3-year-old and a almost 4-month-old at home, and I can attest to all these things. These are big. Kids are great, and they're huge stressors as well. So there's all sorts. And the way that I like to think about stress is it all goes into the same bucket. Like your body doesn't differentiate, your brain doesn't differentiate between the different types of stressors in your life. And there are positive stressors and there are negative stressors. So a negative stressor is like, how am I going to afford to provide for this kid? Where are they going to sleep? And the demands of your time. There's all sorts of those things. And then you also, maybe you're very excited about the addition to your family, and that's still a stressor because there's a lot going on. There's a lot to plan for. There's a lot to worry about. So these are all stressors that add up cumulatively, and not to mention all the other things going on in your life at the same time. So any work-related stressors and financial stressors, other relationship stressors, family stressors, all those things are still there, and you've added this other stressor to your life. So, it's hopefully for everyone, it's a net positive. But there's a lot of stress that goes along with that, and the more stress we experience, the more likely we are to experience a mental health condition like depression. Everybody under enough stress will express something will come up. So one of the things that I learned while putting this presentation together is that depression in postpartum men may look a little bit different than it does at other times. And so some of the things that we may see would be irritability, indecisiveness, and restricted range of emotion. And frankly, it probably has a lot to do with men just feeling overwhelmed and not knowing what to do. So that's probably has something to do with indecisiveness, and they want to rely more on or their partner if they have that option to help with that. And maybe they want to take responsibility for it, but they just don't know how. So there's just some of the things to look out for. Probably not that much different than at other times, but we may see these symptoms more pronounced. And yeah, that's all I'll say about that. So is paternal postpartum depression treatable? What do you all think? Yes, of course. So the same treatments that we know work for depression at other times can also be effective for paternal postpartum depression. So I believe there's some evidence for cognitive behavioral therapy and interpersonal therapy So these are evidence-based treatments for depression that are therapies for depression that can be effective. And then, of course, antidepressant medications can potentially be helpful as well. Are you all familiar with cognitive behavioral therapy and interpersonal therapy and how those things may differ? I'd be happy to explain a little bit about what therapy for depression looks like. So I can give you my little elevator speech here. So cognitive behavioral therapy, or CBT, focuses on helping people recognize the relationship between their thoughts, their behaviors, and their feelings. And we kind of think about it from the perspective that we do not have direct control over our feelings. That's why telling somebody that's feeling down to cheer up, while well-intended, likely isn't going to lead to them instantly cheering up and feeling better. So if I don't have direct control over my emotions, which we wish we did, but we don't, I could benefit from focusing on these other areas, because no doubt my thought patterns as well as my behaviors have a big influence on my mood and each other. So in cognitive behavioral therapy, we help people understand the relationship between their behaviors and how they're feeling. And so what we're talking about is, if you're depressed, are you still doing all the same things that you used to do? How have your behaviors changed? Are you engaging in what we call pleasurable and accomplishment-oriented activities? And oftentimes the answer is no. And I think particularly for men that are experiencing more stress, they are less likely to do the kinds of things that have brought them a sense of relief and help manage their mood in the past. So there's big emphasis on the behavioral components here. And then from the cognitive side of things, we look at how our thoughts affect our feelings and behaviors. And we teach people skills to look at their thoughts more objectively. So a quick example of that is a new dad may say something like, I don't even know how to change this kid's diaper. They won't take a bottle from me. I'm a failure. I'm failing at being a dad. And probably not much of a jump to guess, that if somebody was having those kinds of thoughts, that's not having a positive impact on their feeling, or on how they're feeling, right? That's going to have a negative impact on their mood. And so if I was working with a dad that was having that kind of thought, I would say, let's hold up here. What evidence do you have that you're a failure? And what evidence do you have that you're not a failure? And their evidence is like, well, the baby wouldn't take a bottle from me. And you say, okay, has there ever been a time that they took a bottle from me? Or could you imagine that there could ever be a time in the future when they possibly would take a bottle from you? And they're like, well, yeah, maybe this is the first time I ever tried. You're like, yeah, oftentimes it doesn't work out the first time. We have to keep trying. Has there ever been anything else in your life that you had to keep trying before you were able to figure it out, or the baby was able to figure it out? And you would quickly come to the idea that, you know what, maybe I'm not a failure. Maybe I'm just a normal human being who is not succeeding with the thing I wanted to, and I feel a little helpless about that. And so, we help look at situations more realistically, and all of a sudden, I'm not calling myself a failure anymore. I'm calling myself a normal human being where things didn't work out the way I wanted to one time. And so we look at those thoughts more objectively, and then that in turn can help us feel better or mitigate some of these negative feelings that we'll have. And then in interpersonal therapy, very similar to cognitive behavioral therapy, with an increased emphasis on social relationships, and also looking at changing roles that we're in. And in fatherhood, this is a huge role transition, and this is oftentimes where people experience more depression because they don't feel competent in what they're doing yet. It's going to take some time for them to develop their skills and feel more competent. And as a therapist, you help them recognize that and gain that sense of competency while focusing on maintaining and building relationships too. So interpersonal therapy kind of thinks about us as innately social beings, and we have to have other people in our lives, and we have to interact with those people in order to feel good about ourselves. So that's, hopefully that was a little helpful for y'all. Definitely a lot more to those treatments than my brief little summaries there. But oftentimes, people can go through a course of treatment in a couple months doing these kinds of things and see significant improvement in their symptoms. And basically, you learn skills to manage symptoms. So next thing I wanted to talk about, well, is masculinity all bad? Well, like I kind of already earlier said that, well, I don't think it is by any means. And so some of the positive aspects of masculinity could be achievement. While, we're calling that a masculine trait, there's no reason it can't be a feminine trait as well. But we can associate that with masculinity. That's fine. Adventure, risk-taking. Risk-taking can be fine in certain circumstances. We don't want people to be doing really dangerous, risky things, but one person's risky thing is not as risky to the next thing. So this is a picture of me climbing a long time ago. Some people would say that is incredibly risky. You're insane for doing that. And somebody else would say, oh yeah, I did that last week. That's no big deal. So it's a matter of perspective. And then other qualities that could be really beneficial: strength, bravery, confidence. Hopefully these are things that we're teaching all of our kids, both boys and girls, and using them to our advantage to be the best versions of ourselves. And whenever I was exploring topics for this presentation, I was listening to these TED Talks about masculinity and trying to wrap my head around, kind of what the narrative is in our culture now and how different leaders out there are trying to change that. And I came across this talk. This man, Justin Baldoni, who's an actor and singer and very masculine man. But he had this great quote, and he said, you can use the same qualities that you feel make you a man to go deeper. Your strength, your bravery, your toughness. Are you brave enough to be vulnerable? Are you brave enough to talk to a therapist? Are you brave enough to talk to your partner about how you're feeling? Are you strong enough to be sensitive? That's harder. It's like oftentimes men have to show more strength to do that than what they would normally do. Like it takes way more strength and bravery to talk about how you're feeling than it does to drink a 6-pack of beer. That's easy for them to do. So this is something more challenging. And are you confident enough to listen to the women in your life? And so I loved the way that he framed these masculine qualities and then using them to steer away from the things that can cause men trouble with their mental health, but use those strengths to focus on what can help them cope better with their mental health. Any comments about that? I'm curious to know what you all think. Yeah, thanks, Anna. I really like turning it around too. And it's like, you don't have to be, being more well-rounded. You don't have to be more of something else. Take advantage of the things that you are already valuing and just look at them in a different way, or use them to your advantage to be more like the person you want to be. All right, so I've got a few more slides left, and this is definitely more of a discussion-based one. I've got my own ideas about this. And so the next 2 slides are improving men's health and then supporting men's mental health, which is probably the main reason that you signed up for this presentation. And so, given all the things that we've said about how our culture influences our ideal of masculinity, how men striving to be more masculine to fit into culture can cause more problems in terms of their mental health and cause them to act out, avoid their feelings, and increase rates of suicide. What are we going to do about this? How do you think healthcare systems, community agencies, mental health providers, what do you think we could do to help support men's health? And Katrina, ditto. Yeah, totally agree. I was telling my wife earlier today, that I wasn't anticipating a huge turnout for this presentation because talking about your feelings or going to a presentation about men's mental health is also showing some vulnerability that you're even willing to do that, to listen to it. It doesn't make you weak, it just makes you interested, in wanting to improve yourself. But I was saying, if I really wanted to get this message across, I should probably go to like a monster truck rally or something. And how do you all think that would go over if I give this presentation before the trucks came out? So I am being stereotypical there. That's not fair to me or men, but you probably understand what I'm saying. Okay, so I love what Katrina says, meet men where they are and try to help remove stigma. Yeah, that's exactly how I think about it too. Start in schools with young children, educating them in the full range of emotions that humans feel. Excellent response. I don't even think I thought of that one. I agree too, Anna and Katrina. Yeah, okay, so I had a lot of the same thoughts as you all. So one of the ones that I think is actually most important is and this is what Katrina was saying, we have to meet men where they're at. And so where are you going to catch men? Where are you going to potentially, that's a weird thing to say, where are you going to catch them to talk about their mental health? And one of the places where you could probably do that is like primary care appointments. And men don't go to the primary care providers as frequently as women do. Once they start to get older, those numbers start to catch up. And so we need to be assessing for common mental health conditions when men are receiving healthcare services. So you're already going somewhere to receive healthcare. Hopefully those providers are also asking about mental health. And I can speak for St. Luke's, but even in the time that I've been at Luke's in the last 5 years, we've come leaps and bounds in terms of how we're approaching mental health care across our healthcare system. And now we do routinely assess for symptoms of depression in primary care clinics, and we weren't doing that before. And so nobody would even ask. We're already saying men are less likely to bring up how they're feeling because of this idea as it being a sign of weakness. And so they just wouldn't bring it up. Nobody brings it up. Nobody talks about it. Your blood pressure is okay. I'm going to put you on this cholesterol medication. Yep, see you in a year. And somebody could be really depressed and struggling, and we would never even catch it because we're not asking about it, and they're not going to bring it up on their own. So from a healthcare system perspective, we absolutely need to be asking people these kinds of questions when they come on for their routine appointments. We need to think about mental health as a part of a patient's entire health, not this other part that we don't take care of, but a part of the whole person. And hopefully, that idea is that I'm pretty passionate about in my work in primary care and mental health integration in the past. So anyways, that I think is one of the main things that we can do to help people. Like you all are saying, reduce stigma, talk about men's mental health and evolving masculinity, just like this. Hosting a webinar like this, is a way to get people talking about things. It's a way to think about things differently. And we need more of that. Maybe I do need to go to the monster truck rally or the next fly fishing expo I go to. I can set up a little booth and talk about men's mental health. And then other kinds of things. We need to make services more approachable. And so providing educational classes, skills-based classes, that's something that I'm I'm pretty passionate about. I love teaching people skills to manage conditions and not just be a sounding board for the problems that people are going through, but teach them skills to manage things on their own. Probably comes from part of my own culture and being a man and wanting to fix things sometimes. And so I like helping people navigate that process and learn the skills they need to manage problems. Providing web-based services like this can be really helpful. And as a therapist, you know, it may be a tough thing to get, you know, to talk a man going in to see a therapist, but if they can do that virtually, kind of try it out in the comfort of their home phone or their home over using telehealth or like video conferencing like we're doing right now, that may make it more approachable. And so kind of getting away from the stereotypical stuffy therapist office and thinking about this more flexibly could allow more men to benefit from mental health services and anyone else, frankly. I also believe that increasing transparency about therapy can be really helpful. And if, as a therapist, you know, I want to tell somebody exactly what they're getting themselves into. You know, like if you're working with me, these are the kinds of things that we're likely to be talking about. These are going to be my expectations for you, and this is my treatment plan. And we want to work on this together to come up with a plan that's a good fit for you. And I think sometimes if therapists are not doing that and it's just kind of left open-ended, we lose a lot of people to drop out because they're like, I don't know where this is going. I wasn't feeling better. And, you know, I thought if I talked to a therapist, I was going to get better, but I don't. So they quit. But if they had a better idea of what their expectations were and the things that were actually going to help them feel better, they may be more likely to stick around. And then the other idea, which we kind of talked about, provide mental health services where men are already receiving healthcare services. So I thought primary care clinics. I know at St. Luke's we also have a men's health clinic. Honestly, most of the time we're talking about men's health clinics. They're talking about urologists, and oftentimes they're focused on erectile dysfunction. At the Boise VA where I used to work, the men's health clinic was like a pop-up clinic once a week, and it was just focused on erectile dysfunction. And I think we could do so much better than that, you know, as healthcare providers. And then, oh, I was going to say, and if you do a search for men's health clinics around, what I found was they're testosterone clinics. So it's just a place to get testosterone injections. Really don't think that they're probably providing, you know, comprehensive care in those things. But if you look for men's health, it's like a clinic called like Men's Vitality or something, and they're just giving men testosterone. And not that they don't need testosterone, but if you're going to get men into a clinic like that, there's more that we could do to help them. So, and I don't know those businesses, so they may do that. It's definitely a possibility. Okay. Any other ideas here? The one I really liked that we didn't cover here was Anna's suggestion. You know, like we got to start early. That's part of what was in that American Psychological Association video. Is we have to talk to kids when they're young, when they are being shaped by culture, and let them know that it's okay to have other traits and that they can use these masculine traits in positive ways. That it's okay to express their feelings. You know, it takes strength to express their feelings. It takes confidence to be able to do that. And those are valuable traits. So you can actually prove yourself in those traits by being vulnerable. All right. So, well, how would you know if it's time to seek help? You're like, well, I don't know. Do I need therapy? I feel upset sometimes. Maybe I drink too much sometimes. Like, how do I know if I need therapy? Well, here's some general guidelines. I pulled these from the Mayo Clinic, and they're great. They're basically a lot of our symptoms of common mental health conditions with this qualifier about how much they're bothering you. So if you're experiencing marked changes in your personality, eating, or sleeping patterns, that could be a time to reach help. You have an inability to cope with problems or daily activities. You're just having a really hard time keeping up with everything in your life. Could be time to get some help. Feeling disconnected you're withdrawing from normal activities, you're experiencing unusual or magical thinking. That could be psychotic break symptoms. If you're experiencing excessive anxiety, you can't stop worrying about things. You've been feeling down or irritable for long periods of time. You've been thinking about harming yourself, especially if you're thinking about what you could do to harm yourself. Definitely time to reach help or to seek help. Substance misuse. We define substance misuse as, well, like one, excessive substance use, but then that's also causing you some sort of problem in your daytime, like you miss work because you were hungover, or you got a DUI or something like that. Those could be signs of substance misuse. Extreme mood swings, quick mood swings, and then excessive anger, hostility, or violent behavior. For men, maybe they've scared themselves in terms of how they acted or how angry they got. They didn't know that they'd feel that angry. Maybe they've never acted violently before, and they started to do something, and then they caught themselves. Those would certainly be signs that it was time to get help. All right. And how can you support the mental health of male friends, family members, men you care about in your lives? Number one, I think reaching out to men you are concerned about, and just letting them know that you care and you're there for them. I think that can go a long ways, especially if we know that men are less likely to ask for help themselves, by reaching out and checking in with them and just saying, hey, how are you doing? What have you been doing? What have you been up to? And then and this would go along with that. You're reaching out to them. Well, talk about what you can do with them. Talk about spending time with friends or loved ones. Encourage them to spend time with friends or loved ones. I think one that's totally relevant to the paternal postpartum depression is encouraging men to spend time with their friends still. It's easy to get overwhelmed by everything going on at home and stop spending time with your friends. I know that's something that I've experienced before, where really anytime people get stressed, they start cutting things out of their lives that probably were the things that were actually helping them feel better or maintain their moods. So people stop exercising, they stop eating well, they stop spending time with friends or loved ones. And then unfortunately, those were the things that were actually helping them feel better or keep from feeling worse. But those are kind of what we intuitively give up sometimes. So watch out for that. And then encouraging men to engage in pleasurable or accomplishment-oriented activities. This is why if I'm starting to get irritable, my wife tells me, you need to go fishing. You need to go on a bike ride. And I say, okay, I will. So, giving them permission, encouraging them to do that. I know, one of our, what was it? Trina Francine, I can't go back that far in the conversation now. But if you're like, my son, he's got these 3 kids, he's doing the best he can. I want to help support him. What can I do? Helping with childcare, helping him, use his time to do something pleasurable, accomplishment oriented, and not just work around the house unless you love to do that. There's always more work to be done. This is something that I deal with. It's like, okay, I can let myself not do these household projects and I can focus on doing something fun, and that's okay. And that's actually really good for my own mental health. And we have to always remind ourselves of these. I'm a psychologist, and I have to remind myself of that all the time. So something to be aware of. Invite men to participate in activities, even if they're not responding. They've turned you down the last couple of times. Don't give up on them. You never know when you reach out at the right time and that clicks, and how that can make a big difference for that person. So I think, that's one of the things. If men are isolating and not engaging, we have a tendency to say, well, I tried, they didn't do anything. We should try to keep reaching out with them and continue to let them know that we care. Watch out for enabling or encouraging substance use. So if you've got that free time and you're going to spend your time with your friends, are you going to go out drinking? that's probably not going to be in your best interest. And if we're trying to support them, we need to watch out for enabling that kind of behavior. So, if I know that one of my friends has been depressed and he comes over to hang out or we go do something together, I don't want to be just throwing beers his way because that could lead to more problems for him. So we need to be mindful of some of the things that maybe we've done in the past that could potentially be making something worse for somebody else. Support them, go to healthcare appointments with them when they may be reluctant to bring up issues on their own. I see an insomnia, or I have an insomnia clinic, but I definitely help people with other things too. And, I think sometimes the men would not come if their wives were not there with them. Now, that's not the case for all men, but sometimes I think the wives are making them come to their appointments, or their partners are making them come to the appointments. But if we get them in here and they can learn a little bit about me and what treatment's going to look like, then we can break through those barriers really quickly and identify different things that are going on for them. And I'll tell you one, we're almost at time, but I'll tell you one little anecdote here that's kind of stuck with me. And also another thing to be mindful of that's actually consistent with my next point. And so the point here is be aware of potential changes in mental health during times of significant transition. So just like we were talking about with the birth of a child, things that sometimes we view as positive could really cause problems sometimes. So like retirement, job promotion, the loss of a job, these are huge life events that we may not respond well to, and we may not be able to really talk about it because we feeling a way that we weren't expecting to. And I'm going to pick on the retirement one here. That's probably the one I see the most common. People say, "Oh, you're retired. You can do whatever you want now. You've got all the time in the world to do what you want." But for so many people, and particularly men that are not very sometimes insightful about their feelings, they get really depressed in retirement. They lose the structure. They lose their sense of purpose. And all of a sudden you've been working for 40 some years, and you had tasks, you had things to do, you had people you were working with, and then you take that away and you don't have any other coping strategies. It's a recipe for depression. Anyways, this one patient I was meeting with, he was having problems with sleep, and I use depression screeners in my practice, and he endorsed several symptoms and just feeling like out of it and not sleeping well and feeling like mentally foggy. And I was like, it sounds like you're depressed. You retired a few years ago. That's when you noticed this started to happen. You're not engaging in the kinds of activities you were anymore. It turned into a couch potato. You're sitting on the couch watching television all day. And I don't know anyone that can feel great about themselves doing that for a prolonged period of time. And, kind of explained that whole rationale, like, hey, you got to be doing the same kinds of things you used to do, maybe in a different way now than you did when you were at work. And for that particular person, just that acknowledgement of how he was feeling, and that he didn't have to accept that for the rest of his life, that he actually had control over how he felt, was a huge catalyst for him. And he actually joined our lifestyle medicine program, started eating better, started exercising, started keeping him household projects and doing more fun things. And, within actually, by the time I was able to follow up with him, he was feeling significantly better. And so just that validation that his retirement didn't result in him feeling amazing instantly because he retired went a really long ways for him. So I think as support people, we can look out for those transitions and just know that the expected emotional reaction or the culturally expected reaction may not be what the person is feeling. And if they're not feeling that, they can experience a lot of dissonance between how they thought they should feel and what they're actually feeling. And then that can lead to more depression or other mental health problems. All right, so that's the end of my presentation. I'm more than happy to answer any questions that people may have. I've got a few resources up here for people if they're interested in that. probably things you've seen before. There's one interesting here. The American Psychological Association put out some guidelines for practice with boys and men in 2018. I'll talk a little bit about that in my presentation tomorrow, and how they actually may not be the best fit for men sometimes. And then I also have some references here if you're interested in looking those things up. So thank you for your participation today. Like I said, I'll stick around to answer any questions that you may have. And thanks for engaging with me in the chat box. It makes these presentations way more fun if we can get some conversation going.
Well, yeah, thank you, Dr. Davis, for this presentation. I feel like I learned a lot for sure. And yeah, we're just, every time you present, it's such a good one. So thank you for coming back again. For everyone, we're going to have this recorded and then uploaded to our website. And we're going to try to get it onto our Facebook page as well. So just, yeah, keep an eye out for that. And also tomorrow afternoon from noon to 1, we'll be with Dr. Davis again for our next presentation. And like I said, just shoot me an email and I'm more than happy to register you for that. So anyway, yeah. Great. Well, thank you, Dr. Davis. I'll see you tomorrow, but looks like there's no questions coming in.
Oh, but Katrina has one. Can I answer Katrina's question before we close it?
No,
you can stop recording it if you want, but I do want to answer this question. So what are ways to